Meanwhile, Health and Human Services Secretary Robert F. Kennedy Jr. has raised concern about the addition of fluoride to drinking water. And just recently, one state officially banned the mineral in the community water systems. I spoke with experts to understand both sides of this debate. To fluoride or not to fluoride? That is the question for many state officials as more studies and concerns rise over the addition of fluoride in public drinking water. Anti-fluoridation bills have been introduced in 5 states, with Utah becoming the first to officially ban the mineral. Major medical associations like the Center for Disease Control and Prevention and the American Dental Association support adding fluoride to water for cavity prevention. But the debate is far from settled. Utah Rep. Stephanie Greikes introduced House Bill 81. The first part prohibits a person or political subdivision from adding fluoride to a public water system.
The other part that people don't talk about as much is that it actually deregulates the fluoride prescription. So anyone can go into a pharmacy in Utah and pick up those fluoride tablets or the fluoride drops, whatever their preferred intake method is, and actually have it dosed correctly for them based on their age, where they live, what water system they're on.
Major opposition to fluoride comes from Health and Human Services Secretary Robert F. Kennedy Jr., who took to X days before the November presidential election, saying the Trump White House will advise all U.S. water systems to remove fluoride from public water. He claims that fluoride is associated with arthritis, bone fractures and cancer, IQ loss, and thyroid disease. Dr. Regina Cobb of the Arizona Dental Association says the recommended level of fluoride in U.S. drinking water is 0.7 milligrams per liter, and at that level, symptoms like arthritis are not possible.
If these are my children, I want them to have the 0.07 parts per million. I want them to have that. I want them because I know that that is a safe, efficient dose to have. And it is one that gives us the benefits without any side effects.
But what exactly is fluoride? According to the National Institutes of Health, it is a naturally present mineral appearing in some foods and beverages and added in most toothpaste and mouthwash. And in Arizona, almost 60% of residents receive fluoridated water, according to the Fluoride Action Network. In 2021, water in Nogales, Scottsdale, Phoenix, and Mesa was found to be either naturally or artificially fluoridated, while water in Tucson, Duncan, and Page were among the few cities without the additive. But it brings us to the same question: fluoride or no fluoride? And for Rep. Greikes and Dr. Cobb,
we have science on both sides. It's good for you, it's bad for you. We need to let people make that decision for themselves.
And if you're looking at it at a dentist standpoint, gosh, if we wanted to increase work, take fluoride out of the water. You know, our jobs would be secure. But what we want is healthy patients.
the fluoride ban in Utah goes into effect on May 7th. And here's an interesting fact about fluoride. Trace levels of it are found naturally present in shrimp, raisins, wine, potatoes, and spinach.